Hey guys, Davin Lim, board certified dermatologist. Today we'll be talking about how to shape the lower face. This is a really difficult area, and basically there are three effective ways to do that. Actually four, right? The first one we're not going to talk about, and that's camouflaging the area with fillers. Many videos on that, many methods to do. The reason why I'm not a fan of doing this in most patients, especially when they're aging, is that when you add volume to the lower face, yes, it can make the gel and pre-gel sulcus look good, but you're adding volume, and over time this may accumulate. So let's not worry about that. Let's figure out three other ways. Now, of all these three different techniques, there's one which really excels. The other way you could do it is with injectables using something called deoxychoic acid. So it's known as Carbella or Belcara. It's off-label. If you're using this technique on 20 patients, 1 out of that 20 or even 2 of that 20, so between 5 to 10%, you will get side effects. And one of the worst side effects is basically knocking off the marginal mandibular nerve, right, which is a branch of the facial nerve. When that happens, you may get some weakness, but the weakness often lasts between 6 to 12 months. What it does is the acid itself demyelinates the nerve. So certainly off-label, it can reduce fat. Most people need 2 or 3 treatments, but the side effects to me is just not worth it. I don't use that in my practice. The other big thing in the US is, of course, Ellacor. Ellacor basically is microcoring. It's a very good way of doing things, but you still need several sessions. It's classified as a minor surgical technique, so it's not non-surgical. There's still bleeding, there's still recovery, there's still healing. But this is a way to remove subcutaneous fat. So when you're talking about gels in the lower face, you've got to understand why this happens. And why this happens is basically it's a laxity of both ligaments, but also a change in the superficial fat pads. So the superficial fat pads become ptotic, so they go downwards, they become more inferior in location. Additionally, the fibroceptal network, in other words, a network which is encompassing the superficial fat, becomes more lax. So when this happens, we need, as part of the skin tightening algorithm, is to remove the superficial fat itself. And hence, that's why I say there's three techniques. Now, we talked about Ellacor, we talked about off-label deoxychoic. One of the other ways that we do it, which I think is a more eloquent way, which has less side effects in the scheme of things, is to use what's known as high-intensity focused ultrasound. We can do it on-label using things like the Ultraformer MPT, or off-label using other energy devices. And how this works is basically 2 ways. You've got your ultrasound, which causes your mechanical compression of your fat cells itself. This destroys the fat immediately. And then you get what's known as delayed apoptosis. So the high-intensity focused ultrasound concentrates the energy of radio waves at a certain point. And that point can be 1.5 mil, 2 mil, 3.5, or even 4 mil or deeper, depending on the thickness of the individual skin. So when we do this, we can precisely target these areas. Treatments itself are pretty quick. So on average, when we're doing the gel area, we might use something like 30 all the way up to 70 lines, depending on the extent. We may even go up to the nasolabial fat pads. When we do this, we can target precisely the area of gelness or the area of excess fat or ptosis. And in this situation, when we treat the lower face, not only do we tighten skin, but importantly, reduce the fat itself. Now, most patients require 2 sessions, right? And it's really important to realize that we can't do these treatments at intervals of, let's say, 4 weeks. We need to give it at least 10 weeks, most often 12 weeks, because your outcomes are delayed for between 3 to 4 months. Like I said, most patients require 2 sessions, sometimes 3, depending on the thickness. So guys, this obviously can be integrated into using other techniques to help shape the lower face. Things like your radiofrequency microneedling. You can use things like laser resurfacing if the quality of skin needs to be addressed. Don't forget your injectables, because like I said, I'm not against dermal fillers and soft tissue injectables. Certainly when you're reshaping the jawline, when you're replacing bone, when you're replacing deep fat, they're very important. And neurotoxin on the lower face can also decrease the amount of depression from key muscles such as the platysma. So when we combine these treatments, decreasing the bulk, once again, it's the superficial fat, not the deep fat. When we decrease the bulk, when we provide some kind of skin tightening using the HIFU, using lasers, using RFM, this is where we can reshape the lower face, which is crucial when you're treating patients who are, for example, older than in their 40s, because as we age, we have changes in the superficial fat pattern and laxity as well. So guys, I hope you liked the video. It's a quick one, just explaining how we use or integrate devices like HIFU and the Ultraformer 3 and the Ultraformer MPT when it comes to shaping the lower face.